You're a patient. Tune in and see the power of your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Senese. Nice to have you here on the 4th of July. Hey, if you're joining us, be sure to like and subscribe to the channel. It helps us out. Today, in this powerful and practical episode of UroPatient, I'm going to share real-world insider strategies to help families become confident advocates at the bedside. From communicating effectively with the care team to knowing the right questions to ask and how to navigate hospital routines, this episode is going to break down simple but essential tools that can dramatically improve a patient's hospital experience and give families a stronger voice in care decisions. So, watch right now. What if you could learn the insider tips that nurses and healthcare professionals wish every family knew? In this special Hospital Insider Tips episode, you'll discover practical strategies that can help you become a more effective patient advocate, from asking the right questions and preventing communication breakdowns to understanding who to call when something doesn't seem right. Whether it's planned surgery or an unexpected hospital stay, these simple techniques can help improve your loved one's care experience and give you greater confidence during a stressful time. So join me as we master patient advocacy. Your voice could make all the difference. While your healthcare team brings medical expertise, you and your loved ones bring valuable knowledge about your health, symptoms, concerns, and goals. Asking questions, sharing changes you notice, keeping an up-to-date medication list, and speaking up when something doesn't seem right all help your healthcare team provide safer, more personalized care. The best outcomes often come when patient, families, nurses, and providers work together with open communication, mutual respect, and a shared commitment to your health. When planning where and when to seek care, timing and setting can sometimes influence your experience. Elective procedures are often smoother earlier in the week, when full surgical and supportive services are fully staffed and there is less weekend transition in care teams. Some patients also prefer scheduling during times when hospital teaching rotations are more stable, such as outside the peak influx of new trainees at the start of academic blocks, though teaching hospitals remain highly supervised and safe. For emergencies, choosing an emergency department that is directly attached to a full-service hospital can be beneficial, since it allows faster access to specialists, imaging, and inpatient care if needed without delays in transfer. Ultimately, the best choice depends on urgency, complexity, and available resources, but being aware of these patterns can help you plan more confidently. Now, being admitted to the hospital versus being placed under observation may sound similar, but it can affect both your care experience and your insurance coverage. An inpatient admission generally means your condition requires a higher level of care, and you're expected to stay at least 2 nights, allowing full hospital services and admission status benefits. On the contrary, observation status is considered outpatient care, even if you stay overnight in a hospital bed. It's often used while doctors determine whether you need full admission or can go home safely. The distinction can influence things like copay, billing, eligibility for certain post-acute services like skilled nursing facility coverage. If you're unsure of your status, it's appropriate to ask your care team or case manager directly so you understand what it means for both your treatment plan and your financial responsibility. Now, the hospital room. Oh boy. Your hospital room is designed like a small care workspace, and understanding its key zones can help you participate more effectively in care. The whiteboard is your number one most important tool. It typically lists your care team members, daily goals, planned tests or procedures, and sometimes your discharge target, so you and your family can stay aligned with the plan. High touch zones include items like bed rails, IV poles, remote controls, tray tables, door handles, which are frequently handled and are important for infection prevention and hand hygiene awareness. The call button is your direct link to the nursing support for pain, toileting, safety concerns, or sudden changes in how you feel. while the rapid response team is reserved for urgent situations where patient is quickly worsening and needs immediate clinical intervention. And then finally, the guest zone is a designated area for visitors to support rest, privacy, and safe movement of staff around the bedside. Healthcare-associated infections are often preventable, and patients and families play an important role in reducing the risk. The most effective defense is consistent hand hygiene, making sure everyone cleans their hands before and after touching the patient or their environments. Don't hesitate to remind staff and visitors to wash or sanitize hands. It is standard practice and an important safety measure. Ask about daily removal or reassessment of devices like catheters, IV lines, since infection risk increases the longer they remain in place. Keep personal items and the bed area as clean and uncluttered as possible, and encourage early movement when appropriate, as mobility can reduce complications like pneumonia or urinary infections. And finally, speak up promptly if you notice signs of infection such as fever, redness, confusion, or sudden changes in condition. Early reporting can make a significant difference in outcomes. Now, here's the confusing thing. Understanding who is on your healthcare team can make your hospital experience less confusing and more collaborative. The charge nurse oversees the nursing unit, helps coordinate staffing, and steps in to resolve issues or urgent concerns. The case manager focuses on your discharge plan, making sure you have the right follow-up care, equipment, or other services arranged before you leave the hospital. A social worker supports emotional, financial, and home life challenges, helping connect you with the community resources or counseling when needed. The pharmacist reviews your medications for safety, interactions, and proper dosing, and often provides education about new prescriptions. A patient liaison or patient advocate serves as your communication bridge, helping address concerns, clarify information, and ensure your voice is heard across the care team. Together, these roles work alongside your doctors and nurses to coordinate safe, effective, and patient-centered care. Clear communication in the hospital can prevent things like confusion, delays, and frustration. One helpful strategy is choosing a single spokesperson, one family member who communicates updates with the care team to avoid mixed messages and ensure accurate information sharing. During bedside handoffs, when nurses change shifts, patients and families are encouraged to listen and participate so important details aren't missed. It also helps to drop the why, meaning avoid framing concerns with why, which can sometimes sound confrontational, instead of saying help must understand, to keep the conversation collaborative. Similarly, try to avoid putting staff on the defensive by focusing on shared goals like safety and recovery rather than blame. This kind of respectful team-based communication helps build trust and lead to better understanding and care decisions. Medication safety in the hospital starts with what we call medication mastery, a simple step-by-step approach patients can use to stay informed and reduce errors. Step 1, the printed list. Always keep an updated, easy-to-read list of all your medications, doses, and supplements, and share it with every provider. Step 2 is the silent zone, meaning time spent reviewing new medications without distractions so you can understand what each one is for before taking it. Step 3 is food interactions, asking whether any of these medications should be taken with food or avoid certain foods or separated from supplements to ensure they work properly. And step 4 is the triage reality, recognizing that in a busy hospital setting, medication questions or adjustments may take time to process, so it's important to confirm urgency and follow up if something isn't addressed. Together, these steps help patients stay engaged, informed, and safer in their medication care. A helpful approach to staying engaged in recovery is the do-it-yourself care, the 16-hour rule, which encourages having a trusted loved one present in the room for extended periods throughout the day, ideally up to 16 hours. That's your day and your afternoon shift. So there is consistent support, observation, and advocacy. During this time, patients and families can actively participate in basic care tasks that support healing and safety, such as helping with meals and feeding when appropriate, tracking hydration and recording fluid intake, and maintaining simple hygiene like brushing teeth, washing hands, and basic bathing or sponge care. These activities not only promote comfort and dignity, but also help identify early changes in conditions that might otherwise be missed. When done in partnership with nursing staff, this level of involvement strengthens communication, reduces complications, and keeps the patient more grounded and engaged in their own recovery process. A simple caregiver's 16-hour survival kit can make a long hospital stay more manageable and reduce stress for both patients and families. Small but essential items like earplugs or a sleep mask for noise control, extra phone charger, refillable water bottle, protein bars, or easy snacks to help maintain rest, hydration, and energy during those long hours at the bedside. Comfort items such as a lightweight throwaway pillow or neck support can make uncomfortable chairs or overnight stays more tolerable. Just as important is a physical notebook and a pen to record dates, times, and provider visits, questions, and key instructions, creating a reliable backup when information moves quickly. Together, these low-cost tools help caregivers stay organized, comfortable, and better prepared to support safe, continuous care. Now, hospital care is a marathon, not a sprint, and preventing caregiver burnout is essential to staying effective and present for your loved one. No one can do everything alone, so it helps to have tag team shifts with other family members. Rotate time at the bedside. Step away for meals, rest, or short breaks so you can return with a clearer head. Even brief moments outside the room can reset your perspective and reduce stress overload. Taking time for mental reflection or a short walk can help you process what's happening and stay grounded. Just as important, treat nurses and healthcare staff with kindness and respect, even during stressful moments, because they are your partners in care and often managing multiple patients at once. A calm, collaborative approach supports better communication, better decisions, and a healthier experience for everyone involved. In healthcare, it's important to use a pause button when facing major decisions so you can slow down, ask questions, and make sure you fully understand the situation before moving forward. This is especially true when second-guessing procedures, where a brief pause can allow you to review risk, benefits, and alternatives with your care team, or seek a second opinion if time allows. The same thoughtful approach applies to billing and insurance auditing, where reviewing charges carefully can help identify errors or clarify what is covered. In more difficult moments, including end-of-life realities, the pause is not about delay, but about making space for honest conversations, value-based decisions, and ensuring that care aligns with patients' wishes and dignity. Taking time to reflect does not mean doing less. It means making choices with clarity, confidence, and compassion. Navigating hospital discharge works best when you use a clear exit countdown checklist to make sure nothing is missed before you leave. Start with a dry run. Ask the nurse to watch you or a caregiver demonstrate key tasks like wound care, medication administration, or injections so you're confident doing those at home. Next, focus on paper trails, making sure you leave with or have access to key documents such as discharge summaries, lab results, imaging reports, and surgical notes for continuity of care. Then confirm your follow-up plan. Ensure that your next appointment with your primary doctor or specialist is scheduled before you walk out the door, not left to chance. If you feel discharge is happening too quickly or you are not ready, you can ask about your rights and request clarification of the important messages from Medicare, which explains how to seek an immediate independent review of a discharge decision if needed. This structured approach helps reduce gaps in care and supports safer transition from hospital to home. The ultimate insider's tip is simple but powerful. You are part of the care team. Your presence, attention, and willingness to engage can make a real difference in safety and outcomes. Keep your notebook handy to track questions, instructions, and changes in care. And don't underestimate small comforts like a piece of candy or a simple personal item that help maintain energy and morale during long hospital stays. Stay consistent with hand hygiene to protect yourself and others, and never hesitate to ask questions or speak up when something doesn't feel right. Most importantly, be willing to stand in the gap, to notice, clarify, and communicate when details don't line up. In many ways, your steady presence at the bedside becomes one of the most important supports in the healing process. So thanks for spending time with me with these insider tips. As somebody who's spent a lot of time taking care of patients in a hospital, I've got a few of them for you. If you found this helpful, share it with a family member or caregiver who may one day need it. at the bedside. Remember, confidence in healthcare doesn't come from knowing everything. It comes from knowing how to ask, observe, and participate. So stay informed, stay engaged, and most importantly, stay present for those that you love. I'm Vic Senese. This has been UroPatient, and I'll see you next episode. Hey, and hopefully you'll come around next week because I got a great episode for you next week. Here's a little teaser about what that's going to go on. Did I say that right? I don't know. I'm so ready to go out and celebrate the 4th of July.
Have you ever looked in the toilet and thought, why is my potassium citrate pill still there? Did my medication even work? You're not alone. Many patients taking potassium citrate for kidney stone prevention are surprised to find what appears to be an intact tablet in their stool. Join us on July 11th at 10:30 a.m. Central Time to learn more.
Yeah, sometimes these episodes are based on questions I hear from folks out there that are in the urology for some reason. And this came from somebody who had a kidney stone and taking a medicine and was really surprised by what was going on. So you're going to want to tune in next week to learn more about it. But on the other hand, if for some reason you've got a question, maybe there's something you're not sure about, hey, you can always drop something in the comments. I look at the comments and I'll consider doing an episode on it. So don't be afraid to write in. If it's 4th of July by you and you're not watching this pre-recorded, hey, have a fun and safe day. It is by me. I'm going to go out and enjoy the time with some family and friends. And who knows, maybe blow off a few fireworks. All righty. Enjoy our 250th anniversary. We'll see you all next week.